Good afternoon and welcome to another episode of Fertility Talk. We are doing things a bit different at the moment. We're doing a new series called Get to Know Your Doctor. And we're going to be interviewing a few doctors and just talk about, personal things and or not just a few different questions about how they got into being a fertility specialist, why they decided. So today we've got Dr. Coetzee, Dr. Kobus Coetzee. He's from Vitalab KZN. Welcome, Doctor, and thank you for joining us today.
Thanks so much. Thanks for having me.
Okay, so like I said, we've just got a few questions. We've got 5 questions for each doctor, and I'm going to just get into the first question. What inspired you to become a fertility specialist, and what keeps you passionate about this field today?
Well, I think one should first say, why did I become a doctor? Because you
Yes,
don't just become a fertility specialist.
yes.
And I can recall my mom said, while I was in primary school, I came home and said, one day I want to become a doctor. So that was quite surprising because there were no other doctors in the family. But yeah, from that moment on, I always wanted to become a doctor. Um, the fertility side of it, I can recall in 2000 when I started here in Umhlanga as a young gynecologist. I went and met all the gynaes in the area to introduce myself, and there was a well-known gynecologist. I won't mention his name, but he said to me, Kobus, what is your passion? What do you want to do? And I said to him, fertility. He said, well, you should now turn around and go and study for another 4 years,
Wow.
and then come back. And I said to him, well, it's impossible, because I've got too much debt.
Mm,
So I have to work for a few years. And then luckily in 2009, I was able to do my fertility. Yes, fertility is it's amazing. You work with patients where you can really make a difference,
yeah.
and to basically see those patients in Umhlanga. I always say Umhlanga is a very small place, because if you draw a radius around Umhlanga, half of the radius is in the sea, so all the everybody living in Umhlanga and surrounds are very concentrated. So you bump into patients wherever you go, and
Mm,
yeah, just to see the joy that you were able to help them with,
yeah.
to create a family. Yeah.
Listen, thank you very much. The next question is, what's one thing you wish more patients knew before coming to their first fertility appointment?
Oh, they should not be scared of us.
Hmm.
I think, people think when you have to go and see a fertility specialist, you're in trouble, but
Yeah.
that's not true. Not all patients need advanced treatment. But if you can, come and see us earlier because, just a few lifestyle changes, medication, small minor procedure may make the difference and you can fall
Mm.
pregnant spontaneously. We see every week, obviously, when we get the reports of the pregnancy tests and so on, then we see all these spontaneous pregnancies. We
Mm.
still claim them because we had our hand in there, but that's what we want. We want
Yeah.
patients to fall pregnant by themselves.
Thank you.
Um, Leanne, if I may
Yes.
add something else,
Yes.
everybody wants to know their HIV status.
Yeah.
So this is another thing I wish patients know, and that is their egg status.
Yes.
I think that's very important. And, if you want to know if you still have enough eggs, go take yourself to the pathology lab, ask your GP just to do a blood test, an AMH. And, if you want us to interpret that for you, more than welcome. Give us a phone call and we can help you with that. But I
Mm.
think it's also very important that you know your egg status and not only your HIV status. Yeah.
Thank you. That's a good one. Thank you, doctor. So the next one is, how do you unwind after a long day in the clinic or lab?
Well, I've got a few passions. One of them is cooking.
Oh,
So,
nice.
yeah, I like to experiment a little bit with some dishes, especially over weekends and so on, as long as it includes meat. And for my sins, I have to Then my other passions are obviously playing some golf, and I also do like cycling. So
Okay.
that's more to keep fit. And then after a difficult day on the golf course, I'm so glad I don't have a day job, because if I had to make money out of golf, it would definitely not not work.
Thank you very much for that. Um, the next one is, what has been one of the most memorable or rewarding moments in your career so far?
Oh, there are
I like
lots
this
and lots.
question. I actually like this
Yeah.
question.
Well, I would say, just recently qualified, or when I qualified as a fertility specialist, I was in very close contact with my mentor, and it was basically a phone call after the OPU, phone call after the fertilization, phone call after the embryo transfer. And I must say, the first transfer was positive as well. So I phoned him and I said, Prof,
Mm.
my success rate is better than yours. I've got 100%. So the first pregnancy test obviously was very special. And
Yeah.
I have to say, earlier this year, a little bit more recent, I had a patient from Pietermaritzburg. She was 45 and 11 months, and she's currently about 25 weeks pregnant with her own egg, you
Oh,
know.
that's amazing.
And yeah, and that does not happen very often. So I don't want patients to wait until they're 45,
Mm.
if they want to have a baby. But
Yes.
it just shows perseverance,
Yeah.
and yeah, there's help out there.
Great stuff. Our last question, another very good question is, if you weren't a doctor, what do you think you'd be doing instead?
Yeah, maybe a fun question for you, but very difficult for me. Yeah, because I've always thought I'll be a doctor, but it would definitely be maybe to still help people, but or maybe a farmer.
Wow.
I like growing stuff, so I do have a little vegetable garden going, and so on. But or maybe I would have done IVF on the cows. I don't know.
Good one. Thank you very much, Dr. Coetzee. So, Dr. Coetzee, like I said, he is based at Vitalab KZN. If you want to get hold of them, they've got a website, and you can also contact them directly. And they're on social media as well. Doctor, do you mind giving me your contact number as well, please, if you don't mind, for Vitalab?
Yeah, yeah, it's 031-880-1700.
Okay, thank you very much. Or you guys can always DM me if you want to get hold of Dr. Coetzee. Thank you very much for your time today. I really appreciate it.
It's a pleasure, and enjoy your evening.
Thank you. Bye.
Bye bye.